Welcome to another episode of It's All Mental. My name is Asiat. All we do here is talk about conversations that have to do with our mental health. And today's topic is more related to the mothers, because motherhood is a gift that we get to embrace every now and then. But there are some challenges that come, what we call the postpartum depression. And we want to dissect more about it and get to understand what could be some of the things that are bringing this, what are some of the things that we can do in order to find ourselves that we get the right support. And with me here today is Shanitah Nankya, and she's going to introduce herself to the audience. Shanitah, you're so much welcome. Just tell us about yourself and what you do, the things that you love, anything that you feel like the audience would be able to want to know about Shanitah.
Thank you so much, Asiat. I'm glad to be part of the session today, and thank you for inviting me. Once again, I'm called Shanitah Nankya, a professional nurse by training from Bara University of Science and Technology. I graduated in 2023. I will say, apparently now, I have around 3 years of experience working in research in a maternal child health setting in Kawempe National Referral Hospital. Our research was not about postpartum depression. It was about stillbirth, but as I got to interact with mothers, I got to find out that postpartum depression is also one of the key issues that needs to be looked into, and it needs immediate attention. Whereas many people do not take it as a serious issue, it is really, it's just that very few people have come up to do research about it, and maybe the mothers rarely talk about it, but it's true that people are actually suffering from it. Aside from research, I am interested in teaching, I will say. I am interested in improving health through advocacy and things like that. Yeah.
Okay, quite an introduction, eh? We love that. Well, to someone who is talking about, because you've said you have experience in maternal health, could you share with us anything that has to do with maternal health and all that?
Oh, yes. So maternal health simply means us being able to recognize the needs of our mothers, women mothers, and anything that comes with childhood, childbearing, children, and stuff. Yeah.
Basically that. And when we talk about motherhood, it's quite a big journey that someone is going to take. When we grow up, all of us know if you're a woman, you're at one point going to be a mother. So with your experience and working at
Kawempe National
Referral Hospital, you've been interacting with women. Could you take us through some of the things that women share about motherhood? And because it's something that we all know is on everyday conversations. But when you are in the hospital setting, what are some of the things that women share about motherhood?
Yeah, motherhood is quite a journey. For some, it's planned. For some, it's not. For some, they take it as a moment of joy, while others, it's a sad story, depending on how someone got pregnant, really. It's a 9 months journey for one to... The pregnancy period is usually 9 months, and then after that, we expect one to give birth and then start the whole journey of being a mother, taking care of a newborn and everything. So women, everyone has their own experience, you know. There are those that will come and say, oh, I had planned for this. I even went for prenatal care. So they are having antenatal with their spouses. Their family is very supportive. Like they are so ready for the motherhood. And then there will be this particular mother that will come in. Oh, I didn't expect it. I didn't plan. Maybe I was raped. I am not supported at home. My parents are not supportive. That's if they are not married. My partner is rude to me. They are not supportive at all. They do not want the baby. So it's really a different and unique experience for everyone.
Okay.
Yeah.
So when it comes to first-time mothers, what are some of the things that you feel like could be bringing them? Because you've talked about the happiness, and then also some who have conceived, but then they're not prepared. What are some of the things that you have seen with first-time mothers as compared to women who have had more than one?
You know, having something for the first time comes with a lot of anxiety. Whereas for someone who has had it before, it might not be the same case. The one who has had it before might have prior experience. They know what to expect in what particular trimester of pregnancy. They know that even when their partner at a particular point leaves them, they can still go on with the pregnancy. Now, for a first-time mother, they're just new in everything. They do not know what to do, what to expect. First of all, there are hormonal disturbances, especially in the first trimester. They have to deal with that. And they feel like their partner has to support them specifically. Yes, even family has to support, but most especially the partner. And you might find that most of them will not have that particular support like they expect. They might have so many expectations and are not met, and maybe end up like worrying, maybe even regretting why they actually
got pregnant
and stuff.
Okay, so that is where the postpartum depression comes in.
Exactly.
Yes, could you tell the person who is watching us, because we have had these stories, but probably they are not hearing them from a professional who is working with the women firsthand. Could you share with us that process and what usually happens with these mothers when they experience postpartum depression, and what are some of the signs?
Yeah, so postpartum depression is a serious mental health issue that I would say has been neglected. Many people are not informed about it, but it actually exists. So it's a mental health issue that is mainly dealing with depression amongst mothers that have given birth. It usually lasts from 6 to 8 weeks, depending. It can happen at any time during the postpartum period. Yeah, and it's characterized by serious signs, irritability, loss of interest in things that one once was interested in, sleep disturbances, fatigue almost all the time, feeling angry, and so many other things. Yeah.
Okay, because people feel like when you give birth, it's supposed to be all happy moments, but then later on, things have a way they twist around there.
Exactly, and I think that's where we've gone wrong, because society has it that when someone gives birth, it's supposed to be a joyous moment. They are supposed to just feel happy about it. Even when they are going through depression, it shouldn't be expressed, because someone will be like, what if they say that I have an issue as a woman? Why am I feeling like this? Like they fail to speak up because of that, of how society perceives motherhood and childbirth to be.
Okay, so in the research that you've been doing, and you say it wasn't mainly about postpartum depression, it was mainly about stillbirths. Could you be in position to tell us more about that regard of what happens, what brings about, someone having stillbirths and all that?
Yeah, a lot of issues come into play for one to have a stillbirth. Some might be health related and some might be social. Health related are women that have complications during pregnancy. For example, people with eclampsia, preeclampsia, people that have diabetes in pregnancy, among others. Then socially, it might be due to lack of support. When one is unable to access health care while pregnant, because they need to constantly be checked. And if they are not checked, they might have complications that might go unseen, and that might make them get a stillbirth. Although stillbirths can also be can also lead to postpartum depression to mothers, because when one expects to give birth and then they are unable to have a live baby, that alone can also put them into depression as well.
I can imagine. You've mentioned that we are talking about first-time mothers, but then also in our communication, you said that even those ones who have ever given birth before experience postpartum. Why is that?
Yeah, so like any other family, when one gets a partner, they decide to have a family, they have children. Maybe one has given birth to, let's say, two children before, and then they are they are not expecting to have a child soon, or they are not planning to have a child soon, but things happen and the woman finds herself pregnant. Maybe she did not take well her family planning or method that she's using, or the method did not work, or so many things. Then she finds herself pregnant. So in that instance, the child is not planned for, and you might find the mother does not like the baby. To make things worse, the partner might not be interested in the baby, and they might end up treating the mother in a way that is not acceptable, abusing them, beating them. I once had a conversation with a particular mother in a community who had stillbirth still. She was in a study, and she mentioned that from the time I got pregnant, my husband did not support the pregnancy. He used to abuse me every day before he left for work. I got so depressed. Whenever I could ask for money to go to the hospital for this particular pregnancy, the husband was not supportive. At one point, he even beat her up. So you see, all those issues lead to the mother to get into depression, even when they have had a baby before. We know that we are in a low-income country. Poverty can kick in any time. So many people do not want to just be giving birth to unplanned pregnancies, because that affects their income as well, or the way they are spending their money and their financial plans as well. So, yeah.
Could you relate this more to age, or do you think that this postpartum depression comes more with age in terms of the younger ones or the older ones? Who are the most affected?
I would think the most affected ones are the young mothers. Why? Especially these ones that drop out of school because pregnancy is not expected. Usually in an African setting, in a Ugandan setting, when you get pregnant while you're still at school, your parents, of course, will not be happy about it. You'll get embarrassed amongst your colleagues because they will still have to go to school, while for you, you will have to sit back at home and wait until you give birth. By the time you join them, maybe they've left you a class, and for you, you'll still be in the other previous class, so you will still feel like you failed at one particular point. And also, given the fact that counseling services for this particular young group are really limited. And thank Kawempe National Referral Hospital, because they specifically put a particular day for the young mothers, and mothers at that hospital that are young are seen on Thursdays, such that these young people get a time to interact with fellow young people. You know, when you see your fellow 18 or 16-year-old who has been maybe in high school, they're also pregnant, you somehow get the strength to know that I am not alone. I will also pass through it. But if you're isolated, maybe you come for antenatal and you're seated with old people who are married. Like, they are married, but here you are.
The eyes they give you.
Yeah, they're like, Mwana yeyo nona. Here you are very young. You just got pregnant with that. Like, you can become depressed.
I can imagine.
Yeah, so the hospital put that, and I feel like it's working, because on that particular day, these young women, they're even counseled, told so many things, told that life does not end with pregnancy, that even if you've gotten pregnancy, you can still continue with your life as you had planned it.
Yes.
Yeah, so, but for the older ones, really, even if it comes, first they have experience, of course. They are married. You know, when you get pregnant when you're married, no one will even say, why is she pregnant? Because you're married. But if you're not, you're young, you're still in school, the PPD has to be high. Yeah.
You've also talked about something that has to do with pressure. And it's some of the things that we have been seeing of late, where mothers find themselves that they're experiencing, I don't know how you call that in the medical term, you could expound more on it, so that the people who are out there, I've seen very many friends or people that I know, they have pressure during the time that they're pregnant, do you think pregnancy is the one that brings that to elevate, or could it be some of the things that it's just in their system?
Yeah, so we have what we call pregnancy-induced hypertension, high blood pressures that come as a result of the physiological changes that occur during a pregnant woman. Yeah, so some people have pregnancy-induced hypertension, whereas some others have already been hypertensive before and have been on medication. So they're still hypertensive even when they are pregnant. They still have to continue with their medication and everything. Preeclampsia and eclampsia, I would say some of the common maternal health issues apparently now amongst pregnant women, and among the leading causes of deaths among mothers. It shouldn't be taken lightly, and that's why we emphasize that women should come for antenatal visits, because when they come for antenatal visits, they're usually all their vital signs are taken, and in case someone has high blood pressures, they're identified early and linked to care such that both the mother and the baby are safe before.
Oh, wonderful information. Shanitah, to that effect, I want us to talk more about what are some of the leading things that are causing this postpartum depression among all age groups that you've mentioned earlier on, the young, the old. What are the leading triggers that are bringing this depression?
Yeah, the leading triggers for depression, there are so many. I would mention some of them, but I want to start with poverty. When I was young, my mother in our home usually says, "Obwavu mpologoma," but indeed, obwavu mpologoma.
Why would she say that?
Yeah, poverty is the beginning of evil, by the way. It can kill you, yeah? Like you what do I mean here? If you're poor, you would not have transport to go to hospital to seek medical care. If you're poor, you will not have the money to buy the necessary things that you need as a pregnant woman, the mama kits and everything. If you're poor, you will not be able to get the best services. Of course, you'll go to the alternative small clinics. That is if the government hospital is far away from you and you don't have transport. So you'll go to the small cheap clinics, and there you will not get good health care as it's needed. Yes. Then the other thing that I would say is among the causes of postpartum depression or PPD, of course, unwanted pregnancies. People that do not expect pregnancies or do not want pregnancies at that particular time take a lot of time to accept that it is pregnancy, that it is true that they are pregnant, and it is what it is, and they have to deal with it. Many people take time to accept that, and by the time they really accept, they're already going into depression. They give birth, they don't want the baby, they feel like the baby is the source of all their problems, which might not be true. The other point is sexual violence. Most often we've seen girls being raped,
Molested.
yeah, being raped and everything. And of course, you do not expect a woman who has gotten pregnant in such an instance to like the baby. They might not know the father of the baby, because when you're raped, of course, the man will run away. Then you start giving birth. Then people call your child a bastard and all that. You end up going into postpartum depression. Then we also have, I would say, we do not have a lot of skilled personnel in our hospitals to be able to, one, screen mothers for PPD and also maybe give them the necessary treatments for the mental health issue. And that is also another factor that really causes PPD to be high and maybe go undiagnosed in many instances. Yeah. Then the high queues, of course, in government hospitals, mothers are usually so many, and they're like 3 midwives, or the health workers are really, their number is low, and they they usually look at the numbers, like I want to finish this queue and finish work and then go home. So they end up missing to screen these postpartum mothers for PPD and stuff. Yeah,
I can imagine. So a lot goes on in there, and it brings the mothers to experience this. Also, I thought about the fact that sometimes these mothers give birth to children who have disabilities, or who are not properly. I don't know how their make is not what you would want it
ones
to be.
that have congenital abnormalities.
Yes. What are some of the things that you've experienced when women give birth to these children in that kind of condition?
First, they are scared to accept the babies because everyone gets pregnant, or they feel like they should have a normal baby like any other woman. But then here it comes and you have an abnormal baby. So they fail to accept the fact that those are their babies. And then secondly, many think that they will not be able to take care of these babies because these babies have special needs that require money. That's why I said poverty. That require money that most of these mothers might actually don't have. Yeah, so they end up getting depressed, don't want to take the babies. They want to leave the babies in the hospital. They wish the babies just died and all that.
I can imagine. What about suicide cases? Have you people been in position to realize or see any suicide cases in that regard when it comes to depression that has to do with postpartum?
Yeah, personally, I have not seen anyone in the past 3 years I have practiced. And also, it really happens with PPD. It's like an extreme symptom or sign for PPD. Yeah.
Okay. To the women who are out there and they are just hearing about postpartum depression, what are some of the things that you feel like you want to encourage them during the time when they are pregnant? And what kind of information do you feel like they should be able to take in rather than just hearing it from Jaja, Mayanga, these people who what do they call them? The ones that help them to give birth in the villages. Yes, the tradition. Yes, they give them information, and in one way or another it affects them, and they get postpartum depression. So, what are some of the advice that you want to give anyone who would want to have children or to be a mother to reduce on the risks of postpartum depression?
Yeah, for those that are not really raped, that go into sexual intercourse with their partners willingly, this is the advice I would give. First, as a woman, give birth for yourself. Like, I've seen so many people come out, so many women, especially the single mothers, come out and tell young girls that when you decide that now you want to give birth, do it. Of course, you would want your partner to be around, but we know these days men do not want responsibilities. It is perceived. Yeah. So when you decide that you're getting pregnant, the first person you need to think about is yourself. Am I ready? Yeah? Do I want this baby? Do I think I can take care of this baby? That saves you a lot from having so many expectations from people. Do not start giving birth for someone else. Like, for example, if you're in a polygamous family and you're like, oh, my co-wife is giving birth, so I have to compete with her. I have to also start giving birth. My dear, you'll go in depression that you do not even expect. First, the choice, you have to be ready, want the pregnant and also want the baby as well. Also, it is very okay for you to feel depressed or to have PPD after birth. People should not lie to you that when you come out and say, oh, I am feeling like this, I am very irritable, I lose sleep, even when the baby sleeps, I'm unable to sleep, that it is making you look like a weak woman, or it is making you look like someone who is not ready for motherhood, really. It's just very okay and normal. And when you realize that you have such symptoms, report to the nearest health center available. Talk to the health worker around. So this is how I feel. It has taken this period. I feel like it's not okay. What do I need to do? Such that they can be able to link you up to a mental health specialist and maybe you can get help. Also, it is it is okay and normal for people to take medications while they are breastfeeding. Yeah, because we know that some myth that people think that when you're breastfeeding, you're not supposed to take medications and stuff. We have medications that are acceptable to be taken while someone is breastfeeding. So that shouldn't stop you from getting care, thinking that when you go to the hospital, they bajja kuwa eddagala, ate olina jjajjaawe waka akugamba tolina mmira ddagala lyonna, biki, those things.
Yeah, I get it. So to government, because you're working at a referral hospital, and with all this research, are you people putting this in mind? What are your words to government in regards to postpartum depression and the women who are experiencing it?
Yeah, my recommendation would be the integration of mental health services into maternal and child health care services. Like, government should put into consideration that it is a necessity and important for a hospital that is dealing in maternal and child health care to have psychiatrists around to be able to deal with these people. And also maybe putting up CMEs to the healthcare providers, the midwives, the nurses, and the doctors that are working on these mothers to learn more about the mental health issues that come along with motherhood. Yeah.
Okay, and what about to the mothers? What words are you telling to them in regards to postpartum depression? Because most of them are scared and they don't know what to do.
Yeah, if you feel like if you have the symptoms and you're not feeling okay, please speak up. Go to the nearest health center and seek for health care. In case you're neglected by one healthcare provider, it doesn't mean that everyone will neglect you. Continue to be assertive. Do not fear talking to your relatives about how you feel. Tell them that this is it, I'm not okay, such that they can also help you in seeking for health care.
Okay, thank you so much, Shanitah, for this wonderful conversation and discussion that we've had about mothers, because it's perceived that most of them don't get to understand what happens when it comes to mental health related issues. They are only thinking that probably something wrong is happening. But in this regard, we are recommending mothers, if it's your first time, even if you have given birth to more than one child, we recommend you, when you have some of the symptoms that Shanitah has mentioned, kindly reach out to the hospital immediately so that you can get support in the right way and you are getting it from a professional rather than getting it from someone who doesn't know about this particular condition that you may be having. And like she said, it is normal for you to experience some of these symptoms, but when you get help, you can be in position to go past it. So I recommend the mothers, when you go for antenatal care, please seek for these services such that they don't come after when you have given birth to your children, so that you can have healthy children as well as you, the mother. You are healthy both mentally and physically. This has been It's All Mental podcast, and we really appreciate the conversations that we keep on having with you. Kindly comment, share, subscribe, share with your community so that we can reach as many people as we can with this kind of information that has to do with our health as well as our mental health. Thank you for listening. Have a good day. Bye.